Good morning. I'm Dan DeRose with 19 News, coming to you from our digital desk. We're about to have a conversation that, frankly, I'm not sure if I've ever had in my career as a journalist. We're talking about toxic mushrooms. This year has been incredibly wet. Spring, or not spring, it wasn't a wet spring, but it was a wet summer. And then, of course, just last week, some places getting 6-7 inches of rain. And that has caused, I've seen it in my own backyard, this blossom sprouting of mushrooms all over Northeast Ohio. The problem with that is some people are picking mushrooms and eating them, and that is sending them to the hospital. In fact, so much so, University Hospitals has already seen more patients this year than they did all of last year. And why that's interesting is because October is really considered the month where they see a lot of patients who are eating and getting sick from toxic mushrooms. So you think about how wet falls can be. That's good mushroom time. But the fact that they've already seen more patients is interesting. Not only are we going to speak with a doctor in this area, we're also going to hear from a couple who went through this themselves. A man who ingested toxic mushrooms, and just a few minutes ago when we had him up both with the doctor, he actually thanked Dr. Pierre Gollum for saving his life. Doctor, we're going to welcome you in. He is the medical director of the Liver Center of Excellence with University Hospitals. Doctor, how are you this morning?
Great. Thank you for having me.
This is an interesting topic, again, not one that I've covered very extensively in my career. What is it that the message that you want to get out? We are seeing a ton of mushrooms. I'm not sure how anybody knows which ones are safe and not safe. What is the message you are trying to get out today?
Right. Well, thank you to you, Dan, and to Bill, who has graciously agreed to spend time and effort to spread the word in order to ensure that more people don't have to go through this ordeal. Mushroom poisoning, or more specifically, what we call amatoxin poisoning, is a very serious, life-threatening condition that even with today's modern medicine can kill about 1 in 3 people who end up ingesting large amounts. This is not a minor issue. Um, it typically almost never happens before the fall, and certainly before October. I've personally never seen a case before October 8th, and I've been treating this since 2009. But this year, it is not even, we're barely in the beginning of September. We've already seen 8 cases. That's about almost twice as many as we saw all of last year. The earliest case was August 8th, which is pretty much unheard of. These are typically things we associated with the fall. The bottom line for folks who are interested in foraging and eating mushrooms is it is simply not worth the risk at this point to do this while these mushrooms that are actually toxic and potentially life-threatening to ingest are around. That is the message we'd like to spread for the time being so that we can keep the community safe.
And what's interesting, Doctor, is we were just having a discussion here in our newsroom that there are even Facebook pages, Facebook groups, where people are on there saying, hey, I'm out foraging, I found these, is this a good mushroom to eat? You said it just so eloquently, it is not worth the risk. Let's talk about what it can do to a person's system. Obviously, you're with the Liver Center of Excellence, so I'm assuming it has something to do with attacking the liver if you ingest this. What are the symptoms, and is it worth it?
Sure. So typically after ingestion of these amanita mushrooms, which, by the way, can actually taste quite good and do not have any deterring odor or shape or anything like that, and are not in any way inactivated by freezing or cooking. Very important point to tell folks about. Typically within 8 to 12 hours, folks develop diarrhea, nausea, and vomiting. This can last for up to 48 hours, and it typically brings people to the emergency department. People can get severely dehydrated and even get kidney failure from this. But that, believe it or not, is not the worst of it. The worst of it is 72 hours on the onset of liver failure with jaundice, problems with blood clotting function, and all the consequences that bring me and folks like me to the picture. And that typically is what ends up causing the patient to be in the ICU and potentially to need life-threatening, to need life-saving treatments, and in some cases, a liver transplant.
I mean, you said the stat earlier and really opened my eyes. 1 in 3 people end up dying from this. I want to make sure I heard that. Is that a correct number?
Yeah, so you have to factor in how much of the mushroom the person ingests. That's a very important aspect of this. You also have to make sure that we're talking about Amanita phalloides and Amanita species mushrooms, which are commonly known. I think the name tells it all: death caps and death angels. Anytime you have a mushroom called a death cap or a death angel, there's a reason for that.
Wow.
If you ingest these in large amounts, your likelihood of dying or needing a liver transplant, even with today's medicine, is roughly 25 to 30%.
Is this something that I'm trying to figure out why this may be happening more? Is it something that sometimes this particular mushroom is edible and sometimes it's toxic, or is it always toxic?
I think you're close. So historically, these mushrooms look, unfortunately, a lot like mushrooms that people commonly consume without consequence. And I've actually done some homework this season because it's so exceptionally common. And I will say one thing: easily 60% of the folks we see in our practice who consume this are either immigrants or first generation Americans. And folks in places like Eastern Europe, Southeast Asia, the Indian subcontinent have a long tradition of foraging mushrooms, cooking them, and eating them. And unfortunately, many of the mushrooms they forage back home look very similar to Amanita mushrooms. So, in fact, they may be confusing mushrooms they have been consuming for years with this one, except this one is a very different ball of wax. So,
They're
I think
very,
that may be part of the confusion. Yeah.
very interesting. Again, Dr. Pierre Gollum with University Hospitals. As Dr. Gollum stated, he actually helped a Northeast Ohio man who ingested this. I'm going to make sure that we can hear this. And it looks like, Mr. Hickman, I'm going to have you unmute yourself. Looks like I can mute you, but I can't, or I can mute you, but I can't unmute you. So looks like you're on with us. Mr. Hickman, how are you today? Thank you for joining us.
I'm doing great, thank you.
You're there with your wife, Tammy.
Yeah.
Let's walk through your process. How did this happen? Did you see a mushroom? Are you a mushroom forager? How did this happen, and when did this happen?
Well, the talk earlier was about October being kind of the month. Mine happened September 21st of last year. And I'm not an avid forager. I have picked mushrooms before and eaten them. But, I also have a plant identifier that I trusted too much in that told me it was what I thought it was. And, so anyway, I had gathered some of the mushrooms while I was taking care of my parents' yard, and my wife was cooking a meal, mushroom tortellini. I thought it would go well. So I brought them home and sauteed them, and put them in the tortellini and ate them. And I felt fine. That was probably about 5 o'clock that Wednesday, and I felt fine. They didn't eat them; they were a little leery of it. So, and that was a good thing. They're both smarter than me, my son and my wife. So we went on our normal 4-mile walk, and I felt fine. And towards the end of it, I did feel a little, I kind of call it spacey, but I didn't feel sick or anything. That was the only experience. I just kind of felt like a haze, a little haze, but it was nothing that I really thought about. So we went, through with the rest of our evening. I felt fine, went to bed, and I don't know, it was about 8 or 9 hours later, I became violently ill. And prior to that, when we were going through our walk, I had showed my wife where I picked them, which was next door in the front yard of my parents' house. And so after I got ill, this happens a couple times. You feel after you get sick like that, you're going to feel a little better, with the flu and stuff. And it happened to me a couple more times, and I was feeling worse. And so we started trying to think of what could have happened, and it kind of led back to the mushrooms. So she, thinking quickly, went outside and picked some of the mushrooms in the area that I had showed her, and brought them back in the house, photographed them, and sent them to the Poison Control Center, and they identified them as destroying angel, and advised her to take me to the emergency room, even if I was kicking and screaming, because I'm pretty stubborn. So I knew something was terribly wrong, and so I agreed to go, and was sick the entire way, and pretty much the entire night. So it was pretty miserable. And when we got there, the doctor on staff told my wife to make arrangements for me, because he didn't think I'd make it. Luckily, through some help from a lot of people were contacted. A gentleman at New York State University, and he sent a detailed kind of plan of what should happen to me. He's had over 40 years as a mycologist, Dr. Baroni, I believe his name is. And we gave that to the emergency room doctor, the second one that came in, and she was very honest and told us she had no experience with this at all. And at that point, I don't know who was being contacted. If UH had already been contacted, I don't know. But we shared that information with her, and from there, they told us that we would be being transported to UH as soon as they could get me in, which was the next day, which was still under the time frame of the 72 hours to receive this experimental medication that I know a lot of people spent a lot of time to get it to me. And I'm very grateful. So I started that medication on Friday and had 4 days of the medication that had to be FDA approved. It's experimental. And they have to make it in Philadelphia and fly it to Cleveland to administer it. So it's a huge ordeal, but it saved my life.
That's absolutely incredible. Tammy, I'm going to ask you, if you could, just before I get your question, if you could tilt your camera down just a little bit. And then I want to ask you, when you're in that emergency room and when the doctor starts telling you you need to make plans for your husband, can't imagine what's running through your head at that point.
I'm kind of a half glass full kind of person, and I've been with my husband now for 37 years. And I'll be quite honest, I looked the doctor in the eye. I said, "You don't know my husband. He's very stubborn. The mushroom's not going to take him out. He's going to fight this." And here he is. I just had a hopeful feeling the whole time. I think we acted very quickly, and I honestly, I will be quite honest, I don't mean it to sound callous when I said he's going to pull through this. I had no experience with mushrooms either to this degree. So I didn't realize how many people can die ingesting them. So, I was hopeful. I was just looking at the bright side, and thank God everything worked out. And I also wanted to keep a good attitude for him. I mean, obviously what he was going through, I didn't want that on his mind too. So we just persevered, and thank God for the doctors and UH and everyone involved.
Bill, I want to ask you this. We don't need the exact details, but how sick were you? Sickest you've ever been? I mean, what was it like?
Well, I've never been that sick in my life, and it was to the point where like I said, I didn't think I'd make it. even before I knew what was going on, just how I felt, I just didn't feel like I was going to make it. I didn't know what it was exactly. And, I mean, I could barely walk to the vehicle to get there. I just didn't think I'd make it.
Wow, it's a tremendous story. Let me ask you both now, as we spread awareness, we're getting closer to October, this particular type of mushroom is going to be coming up. Word of advice to people, word of advice on what you do now, or what do you want people to know?
Well, like Dr. Gollum said, it's a very dangerous proposition, especially this time of year. So the safest thing to do, obviously, is to avoid this time of year. I mean, I know there's a lot of foraging groups all around. They've been around for a long time, and they're way more knowledgeable than I am about it. And so I would recommend, if you have an interest in it, to reach out to those people that are experts to help guide you. Educate yourself as much as possible, and not to rely on just one single reference to help you identify things if you're not 100% sure. But this time of year is definitely, you're really risking it. And I will never do that again. I will never forage wild mushrooms again. Just
Dr.
because
Gollum,
I have time to them now.
Yeah, Dr. Gollum, as you hear the emotion still in Bill's telling of this, how does it hit you to hear a man tell you, thank you for saving my life?
Well, can I say something about Bill and Tammy? I think anything that doctors and healthcare workers do to inform the public about the risk of this pales in comparison to a person's experience. And I cannot thank Bill and Tammy enough for actually taking the time and the effort to share their story, because their testimonial is much more powerful than any information I can give on this broadcast today. So
you are
that's
1,000%
all I
correct
will say.
Yeah, 1,000% correct. Let's wrap this up. We've heard from Bill and Tammy Hickman. Bill just went through this. Bill, can I ask what part of Northeast Ohio you're from?
Portage County, Windham, Ohio.
Okay, in Portage. And this again was just a mushroom you saw in your parents' front yard and thought it was okay. Did you use an app? I know there's apps that can supposedly tell you what's a weed and what's a flower. Is that what you were using?
Yes. Yes.
And it just steered you in the wrong direction.
Yep.
And Dan, can I say one word about this? So Portage County historically is I want to call it a hotbed for amatoxin poisoning. If you look at population size, you probably see as many. We just saw 3 persons from Portage County last week. So I'm not quite sure if it's the soil or the precipitation, or I'm not exactly sure, but there's a lot of folks who come from Portage County. Summit County, by the way, also issued an advisory for folks not to forage mushrooms, the Department of Health. And we've pretty much seen folks all the way from Lorain County down to Stark. So you really have a broad area of Northeast Ohio where this can happen. But Portage County is definitely notable.
Dr. Gollum, we appreciate your time, the medical director of the Liver Center of Excellence there for University Hospitals. And of course, to Bill and Tammy Hickman, we certainly appreciate. I'm going to follow up on what Dr. Gollum said. Anytime we can bring somebody that's been through it, somebody that thought they were, were using a correct app, thought they had everything right, to hear your story, Bill, we certainly appreciate it. So thank you for joining us.
You're welcome. Thank you.
And Tammy, thank you. Thank you for getting your husband quick help so that we could be having this conversation.
Thank you.
All right, folks, you take care. Again, this was just something we felt when we saw advisories come out from the Summit County Public Health Department. Even Cincinnati Children's put out an advisory last week encouraging people to stay away from foraging mushrooms because it's just too dangerous. As you heard Dr. Gollum say, it is just not worth it. And I think what we heard from Bill backs that up. If we have any other breaking news, it'll be right here on our digital platforms. Our noon news is coming up in just a half an hour on Channel 19. Until then, I'm Dan DeRose with 19 News Now. Have a good afternoon.
19 News is everywhere. Download our CTV apps and follow us on social media.